Hi, my name is Carrie Walker, and I'll be facilitating the Village Health presentation on prediabetes and diabetes prevention. The content in this presentation is designed only for educational purposes and should not be a place of advice from your healthcare professional on this topic. In order to understand what prediabetes is, it's helpful to first define diabetes. Diabetes is a condition in which a person's blood glucose levels are over 125 and their A1C levels are over 6.4. This is significant because people with type 2 diabetes have a significantly higher risk for heart disease and stroke. Physicians have identified a range below each of those numbers that will serve as a red flag for people diagnosed with prediabetes so that they can take a look at risk factors that may be present in their life and try to make lifestyle variations to avoid moving into a full diagnosis of type 2 diabetes. Blood glucose levels and A1C levels are similar and they're connected, but they're different. Blood glucose levels represent a person's blood sugar level at the time of the blood draw only. And that can fluctuate based on what a person has eaten or not eaten at that point. The A1C level represents a ratio of red blood cells in the person's bloodstream that are coated with sugar. This is a number that is typically associated with more of a person's average blood glucose levels. What is type 2 diabetes? In order to understand diabetes, it's important or helpful to first define two different terms. The first one is glucose. Glucose is a form of energy that fuels your cells. It is created when your body digests carbohydrates, and it's used by your muscle and nervous tissue cells. Insulin is the hormone that helps the glucose enter the cells of the body. When glucose is into your bloodstream after digestion, it then circulates to different cells in the body. It is unable to enter the cells directly and requires the help of insulin. Insulin acts as a key that will open the door of the cell and allow the glucose to leave the bloodstream and fuel the cell. In people with type 2 diabetes, the body is not either making enough insulin or using it well. Instead, the glucose is left to build up in the blood instead of going into the cells. Did you know that 1 in 3 American adults has prediabetes? And of that group, a large percentage do not know, 90%. That's why it's so important to identify what the risk factors are so that we can take a look at our own life and our lifestyle factors that we could possibly adjust to avoid developing type 2 diabetes. Risk factors for type 2 diabetes are primarily lifestyle related. Being overweight and obese increases the number of fat cells that you have in your body. Fat cells are more insulin resistant than muscle cells. Therefore, if you have a sedentary lifestyle, most likely you have a lot smaller percentage of muscle to fat. Having a parent or sibling with type 2 diabetes can also increase your risk of developing it. However, lifestyle factors can largely outweigh the expression of type 2 diabetes as a result of genetics. Age is another important risk factor. As our bodies age, the production of insulin is not as efficient because our pancreas is aging. Some of our cells as we age in our body may not be as receptive to insulin over time as well. The reason why it is so important to manage the risk factors and reduce the chance of getting type 2 diabetes is the impact it has on other chronic disease. Increased glucose levels in the bloodstream can lead to nerve damage. Nerves often are not able to continue signaling and passing on impulses as they used to. Significant damage can occur in the feet, which may lead to amputation. Glucose in the bloodstream also can compromise the blood vessels. The glucose molecules are fairly large and can compromise the inside lining of blood vessels over time, especially in the smaller blood vessels called capillaries. Blood vessel damage in the brain can lead to stroke, and in the kidneys can lead to kidney failure. Blood vessel damage in the eye is what leads to blindness. Other circulatory problems caused by the vessel damage can lead to gum disease, skin problems, difficulty with healing from infection, and even deafness. That's why we're going to spend the majority of the presentation focusing on what can we do to prevent diabetes. Let's take a look at weight loss. Weight loss and physical activity can cut your risk of developing diabetes by more than 50%. In fact, only a 5 to 7% weight loss is required to start your body on a better path to using insulin more efficiently. Physical activity can lower your risk of heart disease and stroke by enhancing the vascular structure of your blood vessels. It keeps them more elastic. Your heart is beating stronger, not requiring as much blood to be pumped. The goal is to build up to at least 150 minutes per week of exercise, which breaks down to about 22 minutes per day, which is very manageable. When we exercise, we build up more muscle. Muscle, as I've referenced earlier in the presentation, has more receptive sites for insulin, so that will help lower your blood sugar. Also, as you exercise, your muscles increasingly need more energy to keep the activity going. So because they need more fuel, they will be, again, plucking more of that glucose from your bloodstream. So I encourage you to take a look at your current lifestyle and really evaluate how active are you. Consider all your exercise activities, such as going to a gym, playing pickleball, walking, and then also take a look at other activities that may require physical activity and moving, such as gardening. Begin to get a picture of how active you are, and then ask yourself, does that build up to 150 minutes or more? It's important before you embark on a physical activity program that you first evaluate a baseline and determine where you are. Once you determine how active you are, then you can decide how to layer in extra exercise if you need. Healthy eating is a significant contributor to blood sugar. The more carbohydrates we eat, the more blood glucose we have, because that's the byproduct of carbohydrate metabolism. Carbohydrates are important because they break down into glucose, and our brain and our muscles need those glucose molecules for fuel. However, you want to aim to have at least half of your plate each time be filled with non-starchy vegetables. A quarter of it should be devoted to your lean protein, and a quarter of it can be devoted to grain or the starchy vegetables, such as potatoes, sweet potatoes, some rice. When you're taking a look at that, you want to make sure that you're using low-fat or low-sugar options. I don't think anybody would dispute the fact that steamed vegetables is a good thing, but if you're coating them with butter or maybe other sauces or dressings on your salad, that's going to offset some of the gains that you were making in the nutrients. So again, if you don't want to be counting calories so much, just simply start by looking at your plate. Does your plate, how close to this does it come each time you're sitting down to a meal? Portion size is key. Oftentimes, by simply cutting your portion, that could be enough to help you lose weight. Don't waste calories on beverages. Oftentimes, where we're trying to figure out how many calories we're consuming, we forget to include the calories contained in our beverages, such as sweet tea or soda or alcohol. An average 20-ounce serving of soda contains at least 240 calories. And how many times do we go out to dinner and the server offers such great customer service and refills that soda, and now we've doubled those calories without even thinking about it. Tracking your food is the best way to see what's happening. You may have no clue about why you're not able to lose weight, but if you actually were able to start writing down everything that you were consuming, as well as how many opportunities during your week that you're exercising, and quantifying those and putting numbers to those, it might help you develop some alternative strategies. Stress management is key because when we're stressed, our bodies maintain higher levels of hormones that can drive up blood glucose levels. It's important to recognize the need for management techniques. Can be normal. Some stress is good. It's similar to having a spice in your life. It gets us going, but it should not overwhelm us. Because you may be going through a stressful part of your time of your life, it's helpful to develop a management technique. You may not be able to get rid of the stress completely during this particular period of time, but you can manage it. Some of the ideas are looking online to find some meditations. We have a wonderful stress management class that will walk you through how to do deep breathing exercises and visualization that is helpful. Getting enough sleep is key to stress management. We don't handle stress as well when we're not getting enough sleep. Consider building a quality support network. Oftentimes, our world can get very narrow, and we find that we maybe only have a couple people that we confide in. Oftentimes, if one of those people is your best friend and is your spouse, if you're having to care for that person, that can limit your outlet to talk to. So I would encourage you to reach out to mental health care, behavioral health care professionals, and they can help get you connected to some good resources. Sleep is critical as well. It's also good for brain health. Certain hormones are released at night that actually control how well your body uses insulin. Previously, it was thought that the primary function of sleep was just to rest our body. But now we understand that certain processes occur during different phases of sleep that don't occur at other times when we're awake. So if we skip those periods of time during our sleep cycle because we're not sleeping through the night as consistently, or we're waking up and getting up, our body is not going to function as effectively. So the goal is to try for older adults over the age of 65 is to aim for 7 to 9 hours of quality sleep each night. However, consider what your normal amount is. If you've always been someone who needs only 6 hours, that doesn't mean that you all of a sudden have to get 9 hours if you're feeling rested. A way to evaluate if you're getting enough sleep is whether or not you wake up, you feel rested. And also that you don't need to take naps during the day. If you are finding that you're having trouble sleeping, I would encourage you to take a look at our sleep class. We'll give you information about how to develop a bedtime routine that will increase your likelihood of successfully sleeping through the night. Exercise is a big factor in being able to sleep well. Previously to 2019, research suggested that while exercise was beneficial for getting good sleep, it was recommended that you didn't exercise prior to 3 hours before bedtime. Now research shows that that's not necessarily the case for everybody. And in fact, if the only option you have to exercise is right before you go to bed or in the evening, it's better to do so than not. But again, remember that each person is an individual and you have to evaluate what works best for you. In summary, there's a lot of things that we can do to prevent type 2 diabetes. The first thing is to know your numbers. Think of the numbers that you obtain from your doctor's visits as your dashboard. Similar to a car having warning lights that indicate if the temperature is getting too high, we have numbers that will serve as flags if things are getting a little bit out of control in our life, and perhaps we need to devote a little bit more attention to different areas. One of them could be weight loss. If our weight has crept up By merely reducing our weight loss by 5 to 7%, losing 5 to 7% of what we need to will greatly increase our body's ability to use insulin. Daily exercise is key to weight loss. And daily exercise also increases your muscles' need for energy, which will decrease your blood sugar. It will also increase muscle, and muscle again needs more glucose and is glucose sensitive. So that will also contribute to lowering your blood sugar. Eating a plant-based diet is helpful, low in fat and sugar. Any extra calories that are not consumed and used during the digestive process and by the cells in the body will be turned into fat. Stress management is key to managing things that happen in our life. We have to be proactive and actually have a program, and sleeping better will round out the list of the things that we can do to prevent type 2 diabetes. I thank you for listening in and joining us on your journey.